Welcome. My name is Brenda. I am the CEO and founder of Launch My Health, and I'm really excited to share more about Launch today and give you a little background of who we are and also share more about what we can potentially offer to employers and in that corporate environment. I'll start with sharing a little bit about myself. I'm Brenda. I am a dietitian by background, and I have about 20 years experience in the healthcare field and started in a large healthcare organization 20 years ago as a clinical dietitian. It was my dream job. I thought I was going to change the world through nutrition, and I pretty quickly found out that that wasn't the case and was a little disheartened by what I could actually achieve. So I was really fortunate to work with a great organization that supported my dreams and what I wanted to do and how I could impact the health of others, and was able to start a program that was really holistic in nature and focused on nutrition, physical activity, and also more of that resiliency or stress management skills. And did that for the past 16 years. And in that 16 years, was able to deploy these services direct to the community, also to other employers and in our internal employees as well within the organization. And I'm really excited about Launch, my new venture, and very excited that the majority of the team that I worked with within the healthcare organization have come with me too. So we've got the best of the best here, and we're a well-oiled machine, and I'm very excited to share more with you. So we'll get started. And just a quick note too, if you do have any questions, please put them in the chat, and we will answer your questions as they come up. So a little bit about our agenda today. We'll give you a Launch overview so you can learn about what Launch My Health is and what we do. Then we'll talk about our employer solutions and what we can potentially do for your business. And then I think the best part of today is going to be your Launch experience, and I'm going to shift things over to the kitchen here, and you'll get to meet Chef Jeremy, and you will see what a customer of ours would get to experience in our membership and taking a cooking class. And then we'll have time for a discussion and next steps. So I hope you guys are enjoying a little lunch yourself, and maybe some tea, coffee, glass of water. So I'm going to start with just kind of grounding us into meeting Beth. Beth is an employee at a very large organization. She's a project manager, she's a mom, she has 2 children, she's married, and she is very stressed at work with a lot of deadlines that she's working with. She also has a child with food allergies. She's often concerned about that and whether her son's going to have a reaction, and looking at food labels and gets confused and just generally worried. And she has another child that's going through a growth spurt, and that child really likes convenience foods and junk food, and she's always trying to get him to eat healthier. And then of course herself and her husband have had their own challenges with stress over the years and have added a little extra weight, and her husband was just diagnosed with high blood pressure and started a medication. And Beth has really struggled with her hormones as she's aging and not feeling the best about herself, and kind of having low energy and motivation, and not feeling that great. So as we kind of grounded ourselves in Beth and kind of that typical employee, we can all identify, and Beth might even be ourself. And everyone has different types of things that they're trying to work through. So as you guys are sitting there having your lunch, maybe sipping on your tea, what kind of problems are you trying to solve in your organization related to health and well-being? And if you want to put those in the chat, that would be great. We'd love to hear what those are. And do you have any gaps? And if so, what are those gaps? And as we have been working on launching Launch, we've been doing a lot of conversations with different leaders in different industries. We have had many conversations, and these are some of the things that we're hearing. is people are really looking for a demonstrated ROI. Although that's not always the most important outcome, it is something that is important to decision makers. And of course, everybody has a budget. They're also looking at improved health outcomes and how they can reduce total cost of care. Those are kind of packaged together, and healthcare costs are continuing to rise. I just read from the American Psychology Association last week that as a result of COVID, 42% of Americans report that they have gained weight over the past year too. So just another fact that the past year has been really challenging too, which leads us to the next one, is engaging with a virtual workforce and looking at the future of how we are engaging with our employees and maybe some permanent changes to how we do our work and where we do our work. Also looking at how do we serve the whole household. We know that families or the whole household impacts everyone. So what happens when you're at work and what happens when you're at home don't happen separately, they're interacting together. So we need to think about what's happening in the entire household. If you think about if you have a family member that's living in your household that is going through maybe a significant illness, or maybe they lost their job, or is having stress with a particular relationship that they have, or you're having financial difficulties as a family, that stress impacts everyone and impacts you at work as well. And of course, they're looking to address resiliency and stress reduction and really that more emotional component of our health. And then lastly, on the forefront of everyone's mind right now is health equity and aligning whatever initiatives we have with that DEI lens. So that's something that we are hearing, and I would love to know, again, if there are any more comments from the group that is on today. And just a few quotes here that we have had from some individuals who have been out that have shared what they are seeing. So they don't want their employees put into a box like obese or diabetic. People don't want to be identified as having a diagnosis. They're a person. Addressing the root cause and what the impact is on the ROI. And also looking at programs and services that their employees will actually engage in and want to use, and not just a check the box kind of program. So here we are, enter launch. We take a positive approach to your health, no guilt trips here. We really focus on the how to. So we all know that health matters, right? 80% of chronic disease is preventable. We know that that is one of the most significant costs that we have as an organization, is all the management of chronic disease and mental health medications and that type of thing that we have. But we have to back way up in order to prevent that. And so we take that positive approach, and we're open to everybody, and we offer services for everyone. And we cannot wait for people to get sick. We have to have earlier interventions, and they have to be different, and that they can't focus on disease. So that's what Launch is here to do. And we really want to reimagine that employee experience and really focus on engagement and community building, and kind of coming in sideways as to how we approach people's health. We need to have their engagement, and that's what we do at Launch. So next, I'm going to tell you a little bit more exactly about what we do and what our model is. So this is an image or infographic of our model at Launch. We have 3 components that we focus on: nutrition and cooking, functional medicine, and mind-body skills. So at the heart of what we do with nutrition and cooking, nutrition is really the science of how food works in our body, and cooking is the how-to or the skills of what we need to do. And those two work in concert together. When I was a clinical dietitian, one of the most common things that people would ask me is, I want recipes, or I don't know how to do that, or they'd be really stressed about, what do I make for dinner? How do I feed my family? Well, my son won't eat this, or my daughter won't eat this, or my husband won't do this. whatever that happens to be, people need the how-to skills, and we focus on the how-to and what you do every single day to make an impact on your life. And so you can see your physician, they're a great partner, and we need to have those check-ins with our physician when we're feeling ill and to have our physicals. But what we do every day is what we have the most impact on. So that's what we focus on in that nutrition and cooking. And again, you guys are going to get to experience Chef Jeremy in a little bit, which is going to be the best part of this Lunch and Learn. Secondly, on here is the mind-body skills. And that really is focused on resiliency. We can't change necessarily all the stress in our lives. A lot of things just happen. Like, for example, the past year, COVID, we couldn't predict that. And there are things that we just have to deal with. And if we have resiliency skills, we can better manage that and be happier every day. And we can be a better person for ourselves and for our family, our coworkers, and show up how we want to show up and not be irritated or stressed or have more of those anxious feelings. So mind-body skills and those practices are really important. And then thirdly, we have functional medicine. And this really is the why behind some of the symptomology that we might be experiencing. So this is the most technical component of what we do, and the most, I would say, complex of what we do. And again, this is getting at the why we might have the symptoms we're experiencing. And I like to give examples of this because sometimes it can be hard to understand. But let's say we wake up on a frequent basis and we feel just kind of like brain fog, and like we can't kind of get out of that, brain fog, and we slept well and, had a cup of coffee and did our normal routine, but just kind of that brain fog. We need to look at why that might be happening. And for some, it might be a food intolerance or a food allergy. So that's what we're looking at with functional medicine, and it can be different for every person. So we don't want to treat it the same. And again, with these three components working in concert together, this is where we can really drive results for the long haul. But most importantly, it's about what's happening today. And the skills and the work that we're doing, the how-to, somebody can feel better in one single day. And in 3 days, you can already see improvement in numbers that impact your health. But most importantly, it's about how you feel on a daily basis. If you can go home on a daily basis and feel really energetic and spend time with your family and not be irritated and be present and be able to enjoy their company. You can go on a vacation and go on the hike that you want to and not stay in the car. You don't have to worry about your health being a factor in what you want to do in your life. So that's what our goal is to help people have that high quality of life that they want. And behind the scenes, we've got all the numbers and the outcomes and the data, but it's really about focusing on what our customers want. Oh, just forgot on here too that we have the Cleveland Clinic that practices functional medicine, and they had a study published that reduced their total cost of care by 10 to 20% for people involved in their programming, and that depended on their diagnosis. But that higher number, the 20%, was for people who had anxiety and depression. So really powerful, powerful numbers. So a little bit about our services. So you've got our model down, focusing on those three areas. And then how we deliver that service is all 100% virtually. And they're in two different buckets. We have memberships and health bundles. In the membership bucket, people have access to over 18 classes a month, and they can join those classes live. So the beauty of that is they get to interact as you can today with me, and you can with Jeremy as well when he starts his cooking demo. But you can ask questions. So if you're in a cooking class and you don't have a lemon, and a lemon is in the recipe, you can say, hey, what else could I use? And he can say, well, you can use a lime would be fine, or an orange, or he'll be able to answer any question that somebody has live. Now, if you can't attend the class live, or you love the class so much that you want to watch it again, or have somebody else in your household watch it, you have access to a video library. And all of this can be done right on your phone. So That's another great advantage too, is the portability and the accessibility of the classes that we offer. And again, the whole household can participate. So whoever is living in your house or where you live can participate in these. And you get all the support that you need. And most importantly, I think, is engaging and fun. Nothing is boring. Boring's out the window. You're going to have a lot of fun. And that's what we believe. Your health should be fun. It shouldn't be something that we think of as negative. It's making us feel good. And it better be fun. And certainly with the food part, it better taste good. And lastly, building group connections and interactions is really important, I think, especially now that we're, kind of starting to come out of this pandemic. We realize how important it is to connect with one another, but that there are other ways that we can have that kind of group community feel, and it doesn't have to be necessarily in person with somebody, so we can still build that community feeling virtually. The second area on here is the health bundles. And these are classes that have a specific goal or skill building in mind. And it's an interactive cohort model, so people are starting and ending together. And it's a way to manage chronic disease and disease prevention. And the benefits are people are taking action and they're getting better results. And there's a study that was also done by the Cleveland Clinic that these group cohort models are actually more effective than having a private visits with your physician. So really interesting information coming out. And I think we're going to see more and more of this group visit because it's very cost effective. And if you have better results, that's obviously beneficial as well. A couple of examples on here too of these courses that we have are Putting Out the Flame. That is based on inflammation and reducing inflammation. So anybody who has any chronic disease would benefit from this. And it just, again, it's nutrition focused to reduce inflammation in the entire body. Restorative Nutrition, The Secret to Wellbeing, that's really a lifestyle series. Again, helping people who are looking maybe on that path, like Beth's spouse who has high blood pressure now would really benefit from something like The Secret to Wellbeing and learning about that holistic lifestyle approach to being healthy and feeling good and having energy every day. The Home Chef Pro, that's a series that really focuses on skill building, and it's not about the recipes. It is culinary school for the home cook. I would recommend this for absolutely every single person. And I've been working with our chef here for over 5 years. And today I am still learning things that I didn't know, and it's always fun. Everything is always fun, which is great. And then you feel more confident in the kitchen. So just a few examples of the courses that we have. And again, it's the two sections there with memberships and health bundles. And a little bit more just about who we are. We have a bunch of photos on here. And I think, again, the most important thing is we are positive. And that really speaks to the cheerleader portion of who we are. We are here to help people feel good about themselves, not feel bad. We have enough things in our lives that make us feel bad. We're here to boost people up and help them achieve whatever it is that they want and meet them where they're at. We are truth seekers. There is so much information out there, and whether it's social media, you're watching the news, you're reading, the water cooler talk, and it is hard to decipher what is right and what is wrong. And I guarantee you that if you want to find that eating a pound of chocolate every day is really good for you, you can probably find a study out there. So we're going to help break down what information is accurate and what maybe necessarily isn't. We're also explorers, and we help our clients explore where they want to go, and we're also explorers ourselves. We're always looking for new and innovative ways to approach health, and we're staying on top of what is trending. And really important to us is being disruptors. And this doesn't necessarily mean that, we're at the top notch for like tech. We're actually going back really old school. We're simplifying things and making things easier and accessible and affordable. And to me, that's disruption. And also we're coaches of champions. We believe that our clients are champions and we're here to coach them and again, cheerlead them, but they are champions of their own health and we want them to feel empowered to do that themselves. So why launch? When we go back to the question that I asked earlier in the presentation, you know, what are you looking to achieve with your health and well-being strategy in your organization, whether you're working in human resources or a leader who's just interested in health and well-being for your organization? These are the things that people are looking for and that we can deliver on at launch. And some of the things that, again, to highlight our outcomes focused, it isn't necessarily what the end user, the client wants, but we know that it's really important to organizations to have that ROI and outcomes, and we have that information. And I'm just going to share a little bit on the next slide. Oh, this is a horrible statistic. 1 in 5 teenage boys in the US are pre-diabetic or diabetic, which is why the household is so important and helping the entire household. So some of our outcomes at launch, an average for people who are in our memberships, 2.4 live classes attended by members every week. That doesn't include classes that are recorded that are attended. Cooking classes, we have a Net Promoter Score of 9, which is great. And we're really proud of the customer experience that we have. For our mind body skills classes, the perceived stress scale, that's one of the outcome measures that we use, is a 6-point reduction, which is statistically significant. And all the tools that we use that are clinical are validated tools. And our medical symptom questionnaire for people who participate in functional medicine are decreased by 50%, which is absolutely amazing. Some of statistically significant again, and some of the other measures that we use are the WHO-5 and then also the Mediterranean Diet Score, which is proven to reduce chronic disease, exacerbation, and the occurrence of it. And this is Megan, a picture of Megan here, and I just have to say, she looks adorable there, but that she really is that happy when she's got all that food and carrying that food around. So she's really excited to talk about nutrition with her clients and again, that cheerleader. So the Launch Employer Solution. Here are the 3 areas that we offer solutions for our employers. And one is employee discounts. The second is an employer paid benefit. And then we have health bundles. I could add a 4th on here, which is customization. And we're always open to having any discussion to design something or curate something that is specific for your organization. But in the employee discount bundle or area, we have 2 ways that we can offer that. We can offer a discount to your employees for your selected services that you want for your employees, maybe based on what you're seeing in your company. Or we can manage that for you and take all the heavy lift off of you, and we can just manage the communication and the engagement with them. And we have a built-in engagement strategy to keep people engaged and wanting to take more classes and become a part of our community so that they feel supported. The second way is an employer paid benefit. And this would be, you could do that a number of ways. You could offer your employees a certain amount of money to use for our services, or you could design what services you want to offer and you pay for that for the employees to use. And we can do that in different pricing models, whatever you prefer, PEPM or just a direct pay. And then thirdly on here is our health bundles. And that would be for an organization that really wants to target maybe a specific need, and they could offer a health bundle at a flat rate for all of their employees. So very simple. And that was back a few slides where we had like the anti-inflammatory nutrition program and like the Home Chef Pro. And again, that's like a flat fee for all of your employees to participate in. So 3 ways: employee discounts, employer paid benefit, and the health bundles. And before we transition to the kitchen with Chef Jeremy, I had to add this quote in here. It's one of my favorite. If you don't know Dr. Mark Hyman, he is the medical director for the Cleveland Clinic Functional Medicine Program. He also has his own clinic on the East Coast, and he is very well known in the functional medicine world. I think, you know, that guru. And his quote here is, "Your fork is the most powerful tool to transform your health and to change the world." And we know that, you know, food is just one component of our health, but it's probably about as close as you can get to a magic bullet when it comes to our health, because it impacts so much more. It is not just calories that go into the body. It is so much more. It's connected to our community. It is connected to us socially and emotionally as well. And one of the facts I like to share too that a lot of people don't know is that 90% of your serotonin is actually produced in your gut. So if you think about that chemical that we need for our emotional health is really found in the gut, most of it. And what we eat really does make a difference and can make a difference again in a day. So I'm going to leave you with that quote and transition over to the launch experience, which is going to be with Chef Jeremy in the kitchen. And he's got a fun presentation for you so you can experience what one of your employees would experience if they had a membership and were taking a class. So I'm going to toss it over to Jeremy in the kitchen, and you'll get to see what he's got cooking over there.
Chef Jeremy here. Welcome to the kitchen. Who is ready for some quinoa, flax meal, and turmeric? No? Over? No? All right, you guys, I'm just playing with you. We love those ingredients, but I'm guessing that you might not be too excited about them, perhaps, and your friends, family, coworkers, colleagues, employees, patients, whoever, might not be exceedingly excited about them either, right? So today, or what if I said, actually, I should say this differently. What if I said, who's ready for some ice cream? Come on, guys, let's get real. Everybody's ready for some ice cream now and then, right? So today, we're gonna make coconut banana ice cream with avocado, blueberry, and honey roasted walnuts. I'm excited, I know you are as well, right? So we're gonna get into this. And again, you guys, as Brenda said, this is kind of what you might be able to experience as, or what you will experience as part of our programming. So everybody, I think, is gonna be sent the recipe as well, if you don't already have it. And as part of our recipes, and I do build all of the recipes that we provide for lunch. And as part of that, you're gonna get a toolkit as well, which includes an already made ingredient shopping list for you, any advanced prep and equipment list as well, to really help folks cook along and keep the pace in your own kitchens with me also, which is really important because, of course, at the core of everything that we do in our kitchen, it's about cooking together, learning together, communicating together, right? So we don't want to lose anybody. So we always have those tools built to help with that process, all right? So again, I know I don't have a ton of time today. We're gonna get going, and I just wanna talk real quickly about some honey roasted walnuts. So very simple. I just toss with a little bit of honey, tiny pinch of salt, and we just roast them off basically until they become aromatic. Beautiful. It's just going to be a little garnish on our ice cream today. All right. So for the ice cream itself, we are going to go ahead, and there is some avocado, there's some blueberry, and there's some banana, and that's basically the ice cream. The bananas have been peeled, cut, and then frozen previously. So that's going to give us that nice cold texture as well that we're really after here. So we're going to just jump in, you guys. And I have first the avocado. So I'm going to just trim off the top here. And then I'm going to go down right through and around the pit. We're going to twist to remove that guy. And mine are slightly less than ripe today, which, hey, you know what? It happens, right? So we're going to, again, just do that with the other guy here. And again, right straight down around that pit. Twist, okay? And then we're going to tap the pit with the knife, but we're not going to do it in my hand, right? Safety is really important in the kitchen. So we're going to set that down. I'm going to tap that knife into the pit, and we'll twist, firmly grasp to remove that guy. All right, super simple. From there, I'm going to just quarter them like so, and no need to do any fancy slicing or dicing of the avocado. From there, I just grab it and peel it off. Super duper easy. And that's going right into our blender. So peel those avocados. And this is, of course, where, we're going to get some healthy fat. Some fat in our diet is healthy. In fact, we need it to really thrive. So avocado is a great source of that. Avocado into the blender, along with our bananas. And again, I just diced these guys and laid them on a sheet tray on a piece of plastic or parchment paper, because otherwise they become kind of a mess. They stick to your pan, right? So don't do that. And then in the freezer, okay? And these I just honestly froze for a couple hours this morning. You could do this prep the night before if you wanted to. Just get them really nice and cold, essentially. But those guys are going right into our blender here as well, along with some of our blueberries. These I just threw in the freezer as well. Get it as cold as possible because, of course, this is ice cream today, right? So that is going in there, along with a little pinch of salt. I know some people cringe perhaps, or they think I'm crazy. Why would you possibly do salt in something that's otherwise sweet, right? Well, it's really important actually. It's just as important as in those savory things. Use just a little pinch of salt. That's going to really boost and highlight those flavors. Because at the end of the day, when we're doing things like ice cream or treats, we want those flavors to be big and bold. So from there, I'm going to add some coconut milk. And this I just kind of add to add based on the texture, the consistency. So I always have a little bit extra there. And then we're going lid on right here. And we're going to start our blender. We're going to start it up on low. And just kind of get it started. Again, if you it might take a little bit of time. We don't want it to take too much time. But have your some of them have a plunger that you can go on the top. Otherwise, just have a soft spatula handy, and we can kind of work this over a little bit. Again, we want it to take a little bit of time because if everything was too liquidy, right? It's just going to be like a smoothie, and we want it to be a little bit thicker, a little bit more like ice cream, right? There we go. Now we don't want to go too long on that blender because blenders do produce heat as well, right? So we want to kind of get it in there and get it out of there. I have one blueberry kind of hung up here. Again, take that soft spatula, give it a little, you can scrape those sides down if you need to. And then you can kind of base your texture. My texture looks pretty good. If it was really fighting me or if it was super thick, I'd add a little bit more of this coconut milk, but we don't need it right now. So we're gonna spin it one more time. There we go, in and out. And it's time to serve it, you guys. It's that easy. Now from here, I like it's in sort of this soft serve state and it's ready to rock and roll, super fast and easy. But if you like it in a more solid state, take it from here, put it in another container, of course, and throw it in that freezer for a while and it will get more like ice cream, right? So we're gonna take a nice scoop of our soft serve ice cream here, maybe just a little bit more for me, right? We're gonna go right in there, just like that. You can kind of see what we've got here. It's the nuts are just gonna be a little garnish, right? Either in the middle or you could sprinkle them all across as well. Oh, that looks so darn good, you guys. You know what? I just had a little inspiration. What if we took a tiny bit of this coconut milk and just did a little kind of zigzag across it like this? You know what else I just thought of? Maybe a little sprinkle of like some chopped tarragon or even basil, to be honest with you, would be awesome. I mean, you'd be taking it to the next level there. So very simple. Can you guys see in there? Get closer. Can you see? Okay, awesome. And then, of course, it's really important as well to taste your work, right? So I feel like I have to do that. You can see it stands up nice. It has a beautiful, luxurious texture. Really, actually quite sweet as well. The beauty of this, you guys, there's no refined, no sugars in this thing other than what's in the fruit, right? The banana and the blueberry. There's a little bit of honey again on the nut, but in the ice cream itself, there's no additional sweetener whatsoever, right? So you can adjust the sweetness of this based on the ripeness of the fruit. If you like it a little bit more tart, use slightly less ripe fruit. If you like it, if you're one of those, if you got the sweet tooth, you don't need to add refined sugars to this. use those like banana bread bananas, those really ripe, super sweet ones, and it's just gonna increase the sweetness of your ice cream here. So that's what I've got today. Any questions I can field for you guys real quickly right here before I toss it back to Brenda? Oh my God, you guys are gonna wanna make this. Nothing for me? All right, you guys, thank you so much for being here. Maybe we'll do quinoa, flax meal, and turmeric next time for you.
Hello, everyone. I am back, and I think probably I'm looking at Jeremy right now because he was the star of the show. And of course, I'm back to the presentation, but wanted to tie things back to what we do here at Launch and see if you have any questions. I know that there's probably a few questions out there that we have, and I'm gonna have Amanda read them to me because I can't see a screen right now. But please put anything in the chat box and I can answer anything. And of course, while she's looking at that to see if there's any questions, I did want to let you know that we will send a follow-up email to all of you with the recipe that for this ice cream that Jeremy had prepared today so that you have that. We'll also send you a link and get you set up for a free trial so you can see if you want to experience some like a full class and actually cook along and see what your employees might experience and see if your family enjoys this. And also would invite anyone to meet with us to see if you have any questions, and we'd love to talk about Launch some more. So any questions, Amanda?
Yes, what kind of reporting is available?
So we have different reporting that would be available on engagement and utilization. And then of course we would have outcomes reporting available as well based on those outcome measures that I talked about earlier. So the PSS, the multi-symptom questionnaire, and the Wellbeing Index. So, and would be happy to discuss that further to what the outcome reporting looks like.
Do you provide cooking classes based on different diets like keto or gluten-free, etc.?
That is, so I'm not sure if everyone heard the question, but do we provide cooking classes on specific diets? And the answer to that is we don't have specific diets. When our chefs are cooking classes or have a cooking class, they can address certain eating styles. So there might be gluten-free. We also use the chat feature. So again, like let's say you're vegan, you can chat in and say, how do I make this vegan? But we don't have a particular style of cooking, and it's more whole foods based.
How do you address grocery budgets and making sure that everybody can afford these types of foods?
That is another really great question. These are absolutely fabulous questions. So our cooking classes are designed, of course, with your budget in mind. Some, of course, are going to be more expensive than others. But we do have, for instance, last week we had a class called the Frugal Carnivore. And so that really is about saving money and how to be budget friendly in the kitchen. And of course, again, with the chat feature, we always encourage people to ask questions. And oftentimes the chef will give, say there's like a fresh herb, they'll also state what you can use that's dried or a substitute, or that you don't, or add whatever you have in your kitchen. So it really is budget friendly for people.
Is everything education group-based, or are there one-on-one coaching options?
So we do have one-on-one coaching options, and that we didn't include that in on the slide, but that would be happy to discuss that. And we do offer one-on-one coaching for health coaching and dietitian visits.
How do you support engagement for clients who have this for their benefit for their employees?
So one of the ways that we engage people is once they become a member or are in one of our bundles, we have campaigns that are emailed to them to keep them engaged. So let's say you're in, we'll do the anti-inflammatory bundle. If you're in that, after class, you're going to get an email with everything that was discussed and what you need to do. And maybe 3 days later, a reminder like, hey, how are you doing? And some other tips. And so that's all designed and curated by the person who's leading that class. And so they're campaigns to keep people engaged along the process. We also, one other thing just on the engagement side too, we also have incentives for people built in to our membership. So once they attend so many classes, they become a part of our launch crew. And so that's also an incentive for people to kind of keep going and attending. We want people to be in and attending our classes.
Are there best practices for what is considered a requirement for completing?
You know, I would say the best practice in my experience for completing, for instance, for let's say a program, let's say it was 10 sessions, would be a 75%, 50 to 75% of the classes would be attended, would be considered a completer. And I'm not sure if I'm answering the question the way that it was asked appropriately, but.
To understand that the outcome from the class is achieved, how much would need to be completed?
Right. So based on the research that we've done and the evidence that we have, I would say the same answer, anywhere from 50 to 75%. It really depends on the program.
Last question.
These are great questions.
Is there any specific programming based on specific disease or conditions?
Another really, really good question. So our programs are really designed around symptoms and not disease states. So I'll go back to the anti-inflammatory course again, and that really is for anybody who has an inflammatory condition, which is most. And I do want to share a story. This is just experience from the healthcare organization that I worked at. Our Home Chef Pro series, that style of culinary school, we did an IRB approved study in a pre-diabetic population. And our theory was that if we didn't talk about diabetes or being pre-diabetic and that you needed to lose weight and reduce your carbohydrate, we just simply taught people how to eat whole foods and learn how to cook in the kitchen and eat healthier, that they naturally would reduce their blood sugar and reduce their symptoms of being pre-diabetic. And what we found in that study was that exact same thing happened. And it was a randomized controlled study. And the people who participated, we did 2 cohorts. The people who participated in the cooking intervention actually lowered their hemoglobin A1C more than the control group, which was conventional medicine. So
last question, then we'll wrap it up. Is communication done via text, emails, video, telephone? What?
All. So we communicate via email. We also do text messages, and we do videos, and then we also social media. So all of those, all of the above. That was a lot of questions, and I'm impressed. That's great. That is great. So it looks like we're going to wrap things up. Again, I want to thank you on behalf of the launch team for attending today. We will be sending out a follow-up email with information for you on the free trial, and also the recipes from today too, in case you want to make this ice cream, which I think I'll be having a taste of very soon. So thanks again, and please reach out to us and check out our website too, launchmyhealth.com. You can also download our apps in Google Play and the Apple Store. Thank you so much, and we'll be in touch soon.